Hello dear friends, am I audible to you? Hi, am I audible to you? Good evening, am I audible to you? Hello. Okay, thank you. Thank you very much. So, shall we begin? With show of thumbs up, can you please tell me if we can begin? Before I start, let me tell you 20317156. Okay, I'll write it again 20317156. This is the code for menti.com. This is the code for menti.com based quiz contest that is happening today. This is just like a quiz contest. I would be happy if all of you would join me in this quiz contest. So do you have any questions before we start? Hello. Okay, before we begin, let me tell you a few things. And I'm doing 2 more sessions. The next session is on 14th and the last session of this particular series will be on 16th. So we are doing it as 3-part session. Today also we'll be doing all subjects MCQs. If some of the subjects are missing today, they'll be coming up on 14th and 16th. So we'll be having 2 such sessions again after this. And all the sessions will be at 7 p.m. It is on 11th, 14th and 16th of February 2022. Okay, and this is Dr. Meenakshi Sundaram A S here, MBBS MD, gold medalist in MD exams, and I'm a high-octane educator in biochemistry and microbiology for the past 11 years, and I've successfully placed many students in the top institutions every single year without skipping a year. And I'm a quiz master, so you can expect this also to act as a quiz contest. And before we start the quiz contest, this is a very important announcement for all the people. There is a NEET PG 2022 All India mock test. They are terming it as AIMT. This is a very important test, February 26th, 9 a.m. Please mark this on your calendar. February 26th, 9 a.m. This is the final chance before the final exam. Please complete and test your preparations. You can tap on the link in the bio to enroll. And you will be having a pattern. You will be knowing the questions prior to a main exam. You will have analytics to show how exactly your performance is. And the video solutions will be provided by the top educators. I'll be giving you the microbiology video solutions for you. And this is the preparation phase, and this is how you can actually subscribe for Unacademy. If you buy for 3 months, you will get 1 month free. This offer period is ending soon. 1 month extra will be credited within 30 days, and boost your NEET PG preparation with this amazing offer. And these are the various features of Plus subscription. Use code DRASM live in order to get 10% off plus exclusive access to all my classes. And there is something called as iconic subscription. For this also you can use the same code DRASM live to fight it out. And there is an educator curated test series that is happening on 9th February at 9 p.m. and there is 11th February session at 10 p.m. You will be having different sessions here. You can have a look at it. And there are special class features, and there is an updated question bank. NEET PG 2021 toppers are here. There is a raise a hand feature. And there are 2 such batches coming up, NEET PG 2022 All Educator Revision Batch and Focus FMGE 2022 Comprehensive Batch. There will be 40 plus educator all in one batch, 11th February to 10th May 2022 and 8 grand test series. And these are the Focus FMGE and Target Next 2023 batch course. I'll be teaching in the Target 2023 batch course. I'll be doing the complete microbiology session. And there is also an ultra fast NEET PG 2022 revision batch. I'll be doing it in the month of March. Okay, and these are the different revised rates for NEET PG Plus subscription. The duration, prices have been given here. There is something called as iconic bonanza offer, 6 days for the first 3,000 subscribers, 11th February to 16th February. These are the different ideas, and you'll be having printed notes also. So let's move forward. Do you have any questions till now? Yes. K. Singh, Divya Vinayak and Harish Rahul. Let me tell you the code once again. The code is 20317156. Can you please get into it? This is the code for all the people who are taking this quiz. Please go to website called as menti.com and use code 20317156. I'll type this here also. Go to menti.com website and use code 20317156. Okay, if you have any questions you can ask me now. So shall we begin the quiz contest already? Yes, very good. Please join the session faster. Welcome Lakshana, Harish Rahul, Tanha Yakna, Divya Vinayak and K. Singh. Okay, shall we begin? Please give me a confirmation if you can go forward. We can go with the first question already. Yes. Okay, students, shall we start? Okay, so the all subject MCQs coming up first. Let's go for the first question here. Yes, answer fast to get more points. Which of the following review is not essential before initiating a clinical trial? Scientific review, peer review, regulatory review, ethics review. Which one is not essential for initiating a clinical trial? These are biostatistics and ethics based questions from PSM. Try answering this question. Okay, the time is up. So majority have given the right answer. The right answer is peer review. When you are trying to perform a clinical trial, you don't have to ask your peers to go look for the whole trial before the trial is being done. You can go for a scientific review. Yes, you have to go for literature search before you start studying. Before you're going for a research study, you have to analyze and you have to go for literature review. You have to read about the previous studies that have been done related to the topics given the particular subject. Also, you have to go for the regulatory review. The regulatory board should be able to know and tell you what can be done and what should not be done. And the ethics committee should also give you an approval to go ahead with the clinical trial. But peers means what? Those compatriots of your same age, of your same cadre, they don't have to review it before you go for the clinical trial. And I hope many of you have given the right answer. Thank you very much, people, for playing very well. So for those people who are joining just now, please go to www.menti.com and use the code 20317156 as seen on the top of the screen. Okay, now let's see who is on the leaderboard at this point of time. Okay, O is on top, Heisenberg second, Tom third, Hemlata fourth, Venkatesh fifth, SK sixth, Vote Goat seventh, Dr. Jack eighth, AV ninth, and Lakshana 10th. Okay, that's a good area. Now let's go for the next question instantly. Answer fast to get more points. Question 2 of 26. Which of the following is not a step in framing an ideal research question? Is it literature review? Is it peer review? Is it broadening the initial question or defining measurable outcomes? Which one? Which one is not a step in framing an ideal research question? When you try to start a research purpose, which one is not a step in framing an ideal research question? Research question means what? For every single study you do, the title of the study ultimately becomes the research title and the research question. Okay, so again majority have given the right answer, broadening the initial question. See, if at all you have framed a particular title for the study, then you have to keep on filtering the study in such a way it becomes more and more refined. Refined means if the title is having a huge amount of base, you have to reduce the amount of bases and you have to bring them to a single title and a single finer moment. You're not supposed to broaden the question. You have to make the question shrink as much as possible to focus on a very particular thing. And if you want to go for it, in the previous question I told you, literature review should be done. And please remember, if you want to frame a research question, peer review is good. Defining the measurable outcomes is definitely good. For example, I say in people who are suffering from cardiovascular illness, how much is actually the levels of HDL and LDL. Now LDL, HDL can be an outcome, or the cardiovascular mortality and morbidity can be the outcome. So that outcome can be measurable. But broadening the initial question is not the right answer. So I hope you'll be able to use such kind of logic in the exams. Now this is the leaderboard. Okay, so O is the top, Tom, Goat, Dr. Jack, Heisenberg, Hemlata, Venkatesh, Sana, SK and AV have gotten into the top 10. Well played. Now let's go for the next question. Question 3 of 26. Answer fast to get more points, people. Generation of neurotransmitters like dopamine, histamine, GABA from the respective amino acids required. Which of the following vitamins? Is it vitamin A, B1, B2, B5, B6? Which one? Okay, so again the majority have given the right answer. Can anybody tell me why exactly E is the right answer? Yes, very good, Dr. Sagar D. Punadia. Can you tell me why B6 is the right answer? Anybody? As a free flow of quiz, we should be able to answer such questions also. Tell me. Why do you think B6 is the right answer? Anybody? Excellent, Dr. Amir question. The right answer is about decarboxylation. So what happens if you have DOPA? What is DOPA? Dihydroxyphenylalanine. First, you start with phenylalanine. Phenylalanine on single hydroxylation becomes hydroxyphenylalanine, also called as tyrosine. Again, tyrosine goes to hydroxylation to become dihydroxyphenylalanine or hydroxytyrosine. So dihydroxyphenylalanine is having a shorter name called as DOPA. DOPA on decarboxylation using B6 will give you dopamine. Likewise, glutamic acid on decarboxylation produces gamma aminobutyric acid. That is again another neurotransmitter that also requires B6, and histidine and amino acid goes for decarboxylation using B6 using histamine. So remember, pyridoxal phosphate is a very powerful cofactor in helping in the decarboxylation reaction. Can anybody tell me which vitamin is essential for carboxylation reactions? Which vitamin is very important for carboxylation reactions? Anybody? Excellent, Rijo Alex. It is biotin. The most common vitamin used for carboxylation reaction is biotin. Apart from biotin, which other vitamin can help you in carboxylation? Come on. No, Satish. Satish, thiamine is not helpful for carboxylation. In fact, it causes decarboxylation. But that decarboxylation is not very straightforward. It is called as oxidative decarboxylation. Thiamine is helpful for oxidative decarboxylation as a component of PDH complex, alpha KGDH complex and branched chain keto acid dehydrogenase complex. So I repeat, Thiamine is important for oxidative decarboxylation. So yes, carboxylation. One other vitamin is vitamin K. Venki, it is not B2. B will be having vitamin K dependent carboxylation reactions. So for decarboxylation, we can think of pyridoxal phosphate, and for oxidative decarboxylation, we can think of thiamine. In case of carboxylation, we can think of biotin and also vitamin K. Okay, now let's move forward with this particular question. Let's see the leaderboard here. Okay, amazing. So I think Tom has replaced O. Tom, vote code, Dr. Jack, O, Heisenberg, Hemalata, Venkatesh, SK, AB, Akash have been on the top 10 areas. Now let's go to the next question. Answer fast to get more points. Major antioxidant found in the fluid lining the bronchial epithelium needed in high concentration for recovery from ARDS is what? Is it glucuronic acid? Is it pyruvate? Is it sorbitol? Is it glycogen? Is it glutathione? Which one? When you want to recover from respiratory distress syndrome, adult respiratory distress syndrome, what can be the powerful antioxidant? Satish MSK, very good. You have given the right answer. I believe majority have given the right answer. Yes, glutathione. Now, what about glucuronic acid? Remember, glucose on oxidation can give you glucuronic acid. Now, when something is getting oxidized, something else becomes what? Can you tell me this? Very good, Swarnadeep Hazra. I'm asking you a very simple question. If X is coming near Y and X is getting oxidized, then what happens to Y? Anybody? If X is coming near Y, in the process X is getting oxidized, then Y becomes what? Yes, Y becomes reduced. So when you think about glucuronic acid is the product of glucose. Glucose becomes oxidized to become glucuronic acid. In that process, something else can become reduced. So glucuronic acid is the output of oxidation of glucose, but that is not available in high concentrations in the bronchial epithelium. That is why glucuronic acid is not the right answer. Pyruvate, sorbitol, glycogen does not actually play a role in the ARDS activity. So glutathione is the best answer. Can you tell me which amino acid can help in the replenishment of glutathione reserves? Which amino acid can help in the replenishment of the glutathione reserves? When glutathione levels are going down, where reduced glutathione is becoming oxidized glutathione, which amino acid can help in the bringing back of the glutathione? Srinija, no, not the right answer. Anybody else? Any other answer? How do you bring back glutathione? Glutathione is written as GSH. So think about SH present in any of the amino acids. Which amino acid contains SH? No, Satish, it is not histidine. No, Srinija, not methionine. SH means the sulfhydryl group should be free. Very good, Dr. Amit Varshan and Divya Vinayak. The right answer is cysteine. So please write down, whenever there is a depletion of glutathione reserves, you will be replenishing glutathione by using cysteine residues. The same logic in case of paracetamol poisoning. Whenever you are having excess amount of paracetamol, the paracetamol becomes N-acetyl benzoquinimine, right? So you will be having complete depletion of glutathione. So what is the antidote for paracetamol poisoning? What is the antidote for paracetamol poisoning? Yes, Venki and Lakshana, very good. What is the antidote for paracetamol poisoning? Anybody? Excellent. It is N-acetylcysteine. So the point is cysteine has a major role in replenishment of glutathione. Now let's go for the next question here. Before that, let's look at the leaderboard. Very good. So new people are entering into the top 10. Tom, Dr. Jack, Venkatesh, Salini, Hemalata, AV, O, IMSP, Heisenberg and Sana. Very good. So let's go for the next question here. Question 5 of 26. Answer fast to get more points. Schultz-Dale phenomenon demonstrates what? Microbiology immunology question. Passive cutaneous anaphylaxis, anaphylaxis in vitro, atopy, serum sickness. Which of them? Very good, Amit Varshan, Divya Nayak, Srinja, Venki, Tejashri, Riju, Satish, Swarnadeep. Very good. Okay. Good. Good going, people. A lot of people are giving enthusiastic answers. Very well played. The time is up. Okay. Let's look at the scoreboard. See, the majority this time was not correct. The answer is anaphylaxis in vitro. See, you will be taking any kind of animal's muscle part. So you take an animal's muscle and that muscle will be dipped in a solution containing any of the antigen. When that specific antigen comes and hits the muscle goes for immense contraction. This is happening outside the body of a living animal, and that is why it is called as anaphylaxis that is happening in vitro. So Schultz-Dale phenomenon demonstrates anaphylaxis in vitro. So let's hope you will be able to give me the right answer the next time. Very good, Srinija. Now let's look at the leaderboard now. This is one example where the majority have not given the right answers. See, I have chosen simple questions also, but you're not supposed to make mistakes in that level. Dr. Jack, Tom, AV, O, Venkatesh, Sana, Salini, Hemalata, IMSP and Heisenberg have given the top 10 answers. Now let's go for the next question. Question 6 of 26. So answer fast to get more points. All the following non-structural and regulatory genes are present in HIV-1 except, is it TAT, is it REV, is it VPX, is it VIF? Which one? What is your answer? Okay, 10 more seconds. Anybody else? And among these students who are answering the quiz contest, how many of you are going for the next NEET exam, the upcoming NEET exam? Okay, again, here the majority have given the right answer. What is the question here? We are looking for non-structural and regulatory genes present in HIV-1. And out of them, which one is not present in HIV-1? And you all have heard of VPX. Now, why VPX is the exception? Can you please tell me? VPX is present where? VPX is present where? Anybody? Why did VPX become an exception in this question? Where is VPX found? Yes, I'm hoping for a right answer. Come on, people, tell me. VPX is present in which kind of? VPX is present where? So for those people who did not know, remember, we have TAT, REV, NEF, VIF, etc. NEF is negative expressor. TAT is trans activator. REV is capable of revving up the whole transcription. And VIF is actually capable of increasing the infectivity. While VPX is not found in HIV-1, VPX belongs to HIV-2. So please take a note of this and remember this for your exams. VPS belongs to HIV-2, not to HIV-1. So let's see how many of you got it right and who is in the top 10 area. Okay, so I think AV is displacing everyone. AV is on top. Dr. Jack, Sana, Tom, Hemalata, Venkatesh, O, Salini, Sweet, IMSP, CHMC. Very good. Now let's look at the next question here. Answer fast to get more points. Common organism causing acute salpingitis. It's an OG plus microbiology question. Is it mycoplasma? Is it chlamydia? Is it gonococcus? Is it treponema? Which one? What is the common organism causing acute salpingitis? Is it mycoplasma? Is it chlamydia? Is it gonococcus? Is it treponema? Which one? Sairam Kolipara says B. Anybody else? Srinija is also saying B. You have 10 more seconds. Come on, people, go for it. Okay, so everyone has voted. The majority have given the answer as chlamydia, but the right answer is gonococcus. Remember this very clearly. When you have acute salpingitis, you are focusing on the infection of the fallopian tubules. Chlamydia is a slowly multiplying organism compared to that of gonococcus. Gonococcus replicates faster compared to that of chlamydia, and that gonococcus is capable of causing a pyogenic infection, while chlamydia causes non-pyogenic infection. And gonococcus is the most common cause of, I repeat, gonococcus is the most common cause of acute urethritis, and it is capable of attacking your genitourinary tract just like chlamydia, but gonococcus is capable of causing salpingitis in a very subtle manner, unlike that of chlamydia. Because gonococcus is not causing much of clinical significance or clinical exposure, that is, it will become mostly asymptomatic. Because gonococcus is asymptomatic, or female gonorrhea is very asymptomatic, people tend to ignore it, and or the people are not actually knowing about it. So because people are ignorant about the presence of gonococcus inside themselves, slowly it can cause more amount of complications, and that salpingitis can cause adhesions, because of which it can later lead to sterility. So mark my words, gonococcus is a very important cause. The number one cause of non-gonococcal urethritis would be chlamydia, followed by that of ureaplasma. Now let's look at the leaderboard here. Wow, there is a new person called as Dragonite coming into the top 10. Well played. So AB is on top, Dr. Jack 2nd, O 3rd, Sana 4th, Tom 5th, Hemlata 6th, Venkatesh 7th, Salini 8th, Dragonite 9th, and Sweet 10th. Now let's look at the leaderboard. Question 8 of 26. Answer fast to get more points. Commonest cause of genital fistulae in females in India. OG question. Is it obstructed labor? Is it open surgical therapy, radiotherapy, laparoscopic injuries? Which one? Among the given choices, which one is the commonest cause of genital fistulae in females in India? Okay, Abhirami, Swarnadeep have given A as the answer. Sairam says D. Let's see which one is right. Satish is also saying A. Excellent. So I think majority has given the right answer. It is obstructive labor. Remember, the concept is the same. When you think about a closed cylinder which is hollow, a closed cylinder that is hollow, the more the pressure that happens in the cylindrical area, the pressure will try to open up and enters and exits the whole area in the cylinder. What exactly am I trying to say? For example, think about your rectum and the anal canal. If at all a patient is having a lot of constipation, because of constipation, continuous pressure will be given in the sphincter area. The sphincter becomes more tighter, or the stools are not able to move forward, because of which the patient can have fissures. And as the fissures are happening, the fissures will slowly become fistulae. Likewise, whenever you think about genital fistulae in a female, obstructed labor, because of obstruction in the labor, increased amount of intra-abdominal pressure will make sure some amount of fissures may happen. In the absence of fissures also, fistulae can happen. So in India, the commonest cause of genital fistulae in females will be obstructed labor, not the surgical therapy. Surgical therapy can actually cause, but that is not the commonest cause. So I hope you will be able to use this information in your exams. So almost all of them in the top 10 have given the right answer. Okay, AV is on top, Jack 2nd, O 3rd, Sana 4th, Venkatesh 5th, Hemalata 6th, Tom 7th, Salini 8th, Sweet 9th, and Dragonite 10th. Now let's go for the next question here. Question 9 of 26. Answer fast to get more points. spin barkite of cervical mucus is maximum in which phase of the cycle? Simple question. It's a very commonly asked question for a final year student. Early proliferation, ovulatory phase, post-ovulatory phase, menstrual phase. Which one? Spin barkite of cervical mucus is maximum in which phase of the cycle? Yeah, Stuart Broad. Yeah, Stuart Broad has not been there for the last 1 or 2 quizzes, I believe. I hope he comes back again. Yes, Sairam Kullipara, Darshini Silkumaran, Abhirami. Yes, it's a very common answer. The right answer would be given by the majority of the people. It is ovulatory phase. Spin barkite, the kind of the spirals that you see in the cervical mucus, is maximum in case of ovulatory phase. Can anybody tell me why there is a spin barkite appearance? What is the exact reason? Sairam Kollipara, initially you gave the right answer, but then you changed your answer. Tell me why there is a spin barkite appearance. Sairam, Chandan, Abhirami, Satish have given the right answer. Can anybody guess why there is a spin barkite appearance? No. Yes, because of more estrogen. What is exactly happening? What is happening in the cervical mucosa? Is it thicker or thinner? Is it becoming thicker or thinner? Okay, let's move forward. Let's look at the leaderboard here. Yes, very good. It becomes thinner. So we have 8 out of the top 10 people giving the right answer, because of which they'll be still taking on the top 10. AV, O, Sana, Hemalata, Dr. Jack, Venkatesh, Tom, Salini, Sweet, Dragonite. Let's go for the next question here. Question 10 of 26. Answer fast to get more points. All the following are common causes of epistaxis except. Which one is not a common cause of epistaxis? Thrombocytopenia, allergic rhinitis, foreign body, nose picking. Among them, which one is not a very common cause of epistaxis? Okay, so many people have actually come very close. Sometimes allergic rhinitis may cause epistaxis. Nose picking is not a very common cause of epistaxis. Thrombocytopenia, foreign body, both can cause. You will always have to think about the choices between that of allergic rhinitis and that of nose picking. Allergic rhinitis has a lesser chance. Technically speaking, when it comes to epidemiology, allergic rhinitis has a more common cause of epistaxis than that of nose picking. Okay, let's look at the leaderboard here. Nobody has gotten the right answer for this. Now, question 11 of 26. Answer fast to get more points. Septal hematoma is treated with what? Nasal packing, incision and drainage, nasal decongestants, and antibiotics. Among the following, what is the treatment for septal hematoma? Hapenazone, I'm absolutely okay with your answer. I'm saying it is a common cause, but if at all you try to compare the total number of cases when it comes to allergic rhinitis versus that of that, there have been studies showing that allergic rhinitis can still cause more amount of epistaxis than that of nose picking in terms of numbers, pure numbers. Septal hematoma is treated with incision and drainage. That is the right answer. Very well played. Incision and drainage would be the reason for septal hematoma. And why do you have to drain? Because the accumulation of the blood which has become solidified has to be removed, otherwise it can cause local ischemic changes. And nasal packing and decongestants will not be very helpful for hematoma. Now let's look for the leaderboard here. AV, O, Sana, Hemalata, Jack, Venkatesh, Tom, Salini, Dragonite, and Sweet. I definitely would be able to accept your answer. Yes, thank you very much for the input, happiness zone. I agree with your answer. When it comes to source where I saw, it said the number of cases of allergic rhinitis is very higher. Though allergic rhinitis does not directly cause epistaxis, because of allergic rhinitis, when a person keeps on sneezing, there is a point at which the number of cases in allergic rhinitis is very higher. That is the answer given. But in case you feel no, in case digital trauma is being given, if you are an ENT student, if you know it better, then I agree with your answer also, not a problem. So question 12 of 26. Answer fast to get more points. Tip of the mastoid bone is involved in what? Which of the abscess? Is it Luke abscess? Is it Bezold abscess? Is it parapharyngeal abscess? Is it subperiosteal abscess? What is the answer? Very good, Dr. Abradip. Anybody else? Yes, Naisa Giraval, Sairam Kullipara, Paulomidas. Yes, very good. Come on, anybody else? Okay, so the majority has given the right answer again, Bezold abscess. Can anybody tell me where does Luke abscess happen? When you have mastocytitis happening, because of which there is injury into the local area and the infection keeps spreading into the from the tip of the area, you can have Bezold abscess. Luke abscess happens because of what? Anybody? No, Mashvekan, subperiosteal abscess is not the answer. Yes, the middle ear to the external air cavity. Middle ear cavity to the external air cavity is the place where the Luke abscess can be spread. Okay, very good, Polomidas. He came so close. Now let's look at who can give you the right answer. Who has given the most number of answers? Yes, Harish Rao. Sternocleidomastoid or lateral to the or medial to the sternocleidomastoid muscles can be noticed. AV, Sana, Hemalata, O, Venkatesh, Tom, Dr. Jack, Dragonite, Sweet, and Salini. Question 13 of 26. Answer fast to get more points. All are used in first trimester abortion except which one is not used in the first trimester abortion? Mifepristone, extra amniotic ethacridine lactate, dilatation and evacuation, suction evacuation. Which one is not used in the first trimester abortion? Okay, the majority have given the right answer. Can you tell me why B is not the right answer? I mean, why B is an exception? Anybody? Extra amniotic ethacridine lactate is given when? Saurabh, Moshfek have given the right answers. Dr. Abradeep is also correct. Can you tell me why extra amniotic ethacridine lactate is the exception here? Anybody? Excellent, Dr. Amit Vashan. That is the thing that is used in case of second trimester abortion. So mifepristone, dilatation evacuation, suction evacuation, all can be done in the first trimester, but extra amniotic ethacridine lactate is given in the second trimester. And if you want to reduce the time duration done for the abortion and for making the abortion easier, you can support the extra amniotic ethacridine lactate by giving a prostaglandin. So prostaglandin can support ethacridine lactate given extra amniotically. Very well played. Very good, Saurabh Kasbe and Dr. Amit Vashan. Let's look at the leaderboard here. AV, O, Sana, Tom, Venkatesh, Hemalata, Dragonite, Dr. Jack, Sweet, and Salini. Sweet has given the fastest answer for this question. Excellent. So now let's look at the next question here. Question 14 of 26. Please answer fast to get more points. Primary dentition is completed by what duration? Is it 5 years, 4 years, 1.5 years, 2.5 years? Which is the answer? Uh, I'm so sorry, there is a small mistake in this question. Now, yes, please don't worry about it. If your answer is not being taken into consideration, do not worry about it, because I have missed on clicking on a particular answer. Yes, the majority is the right answer. Primary dentation is complete. Excellent. Sorry for not having done this, because there's a small mistake I did. I did not click on the particular question before I posted it. Sorry. Let's skip this question because nobody will get the marks or negative answers for this. So let's look at the next question here. Question 15 of 26. Answer fast to get more points. Charcot's artery is which one? Anatomy question. Medial striate branch of anterior cerebral artery, striate branch of middle cerebral artery, frontopolar artery, callosal-marginal artery. Among the four, which one is the Charcot's artery? Yes, very good. Abhishek Gupta, Moshfek Khan, Saurabh Kasbe, Amradeep, Paulami and Swarnadeep and Dr. SP. What is Charcot's artery now? Okay, so majority have given the right answer. Striate branch of middle cerebral artery. Can you tell me what is the Charcot's artery also referred to as? Charcot's artery is also referred to as what? Come on, people. It is also referred to as the artery of the medial striate branch of anterior cerebral artery is referred to as what? Excellent, Dr. Amirthuashan. Artery of hemorrhage is the right answer for Charcot's artery. Now, what is the other name for medial striate branch of anterior cerebral artery? It is the Hubner's artery. So, medial striate branch of anterior cerebral artery would be the Hubner's artery, and striate branch of middle cerebral artery is actually the Charcot's artery of hemorrhage. Very well played. Very good. Majority have given the right answer. Now, look at this part. Look at the leaderboard. Okay, Harish has come into the top 10. Very nice. So, AV is on top, O second, Tom third, Hemalata fourth, Dragonite fifth, Sana sixth, Venkatesh seventh, Dr. Jack eighth, Sweet ninth, and Harish 10th. Let's go for the recurrent artery of Hubner. Very good, Dr. Amirthuashan Hemalata. Let's go for the question number 16 of 26. Answer fast to get more points. 30-year-old female presents in the emergency with sudden onset tachycardia and sense of impending doom. What is the possible diagnosis? Acute exacerbation of chronic psychosis, generalized anxiety disorder, acute panic attack, hysteria. Among the following, which one is the right answer? Excellent. The majority has given the right answer. See, when they say generalized anxiety disorder, it means the patient is having a persistent state of anxiety. For that reason, he doesn't have to come to the emergency department. Also, in case of chronic psychosis, the acute exacerbation need not always present in the emergency room. If it is hysteria, it is actually well seen. It is a neurotic condition. But only when it is a panic attack, you will be having sudden onset tachycardia and sense of impending doom. The two most important keywords are tachycardia and impending doom that can be caused for acute panic attack. Okay, now let's look at the leaderboard here. Okay. AVO, Tom, Hemalata, Dragonite, Sana, Venkatesh, Dr. Jack, Sweet, Salini. Now, question 17 of 26. Answer fast to get more points. Priapism occurs in which of the following? Priapism occurs in which of the following? Snake bite, rat poisoning, cantharite poisoning, arsenic poisoning. An FMT question. Come on, people. Priapism occurs in which one? Excellent. So Abradeep, happy times have given the right answer. Yes, the majority have given the right answer. Cantharide poisoning. Can you people tell me cantharide or cantharidium is having what as the source? The source of cantharide poison is which one? What is the source of cantharide poisoning? There's a very important MCQ. It can happen again. Priapism is a very painful erection. Even though there is no surge of libido, the patient will be having no libido, but there will be erection. The erection is painful. That is priapism, and that happens because of cantharidium. Excellent, very good, Amartvarshan. It is Spanish fly, not bug, Spanish fly, and it is also referred to as sparkling beetle. Okay, sparkling beetle or blistering beetle. Blistering beetle, sparkling beetle, or Spanish fly are the names for the sources of cantharide poisoning. Excellent, very good, Chakravarti. So let's look at the leaderboard now. AV, Tom, Hemalata, Sana, Dragonite, O, Venkatesh, Dr. Jack, Sweet, and Salini. Let's go for the next question here. Question 18 of 26. So we have 8 more questions to go for. Let's see who will be on the top. Excellent. Taking off one's clothes and running naked in a public race is called as onanism, mooning, voyeurism, exhibitionism, undinism. Come on, which of the following is the description? I mean, which of the following is the word for the given description here? Yes, Naisargiraval says D. Anybody else? Yes, Paulamidas, Srinija, Prinzuko, Dr. Abradeep. Everybody is able to come closer. Yes, happy times. Anybody else? Okay, the time is up. Okay, so exhibitionism is the right answer. Can anybody tell me what is mooning? Just find out what is mooning. Can anybody tell me what is onanism? Onanism is also called as what? What is onanism commonly known as? What is onanism commonly known as? Anybody? Onanism is the other name for self-pleasure or masturbation. And okay, voyeurism means peeping toms. You are looking at somebody else who is undressing. And undinism is the sexual perversion of finding happiness or pleasure in case of watching somebody who is urinating. So the right answer here is exhibitionism. Okay, let's look at the leaderboard here. Majority have given the right answer. AV, Tom, Hemalata, Sana, O, Venkatesh, Dr. Jack, Dragonite, Sweet, Salini. Okay. Question 19 of 26. Okay. Very good. Exposure of gluteal region. So that is the right answer. Mooning means. And why did the mooning did not cover this area? Because the patient went bare naked. That is why it was not coming near mooning. The right answer would have been exhibitionism for the previous question. Okay, and are you all okay? Are you all happy enjoying the quiz? Because we have only 7 more questions. I have planned to have 2 more sessions. The next session is on 14th and the next session is on 16th after that. So will you be willing to come for those sessions? Are you enjoying those sessions? If you're happy to come for the sessions, I'll produce more number of questions like that. I have done it in such a way that the questions are not very tough and very simple. They're moderate, decent, so that it can be like a quiz contest. Yes, okay. Thank you, Dr. Salmi, Prinzuko, Polomidas. Okay, I hope you'll be coming for the next quiz contest also. I repeat, the next quiz contest is on 14th at 7 p.m. and also on 16th at 7 p.m. Thank you, happy times. Okay, so question 19 of 26. And if you all like this quiz contest, please put a thumbs up after the session is over. Rotator cuff tear results from tear of one or more of the rotator cuff muscles and associated tendons. The most commonly injured rotator cuff muscle is which one? Supraspinatus, infraspinatus, teres minor, subscapularis. Which one? Thank you, Harish Rao. Rotator cuff tear results from tear of one or more of the rotator cuff muscles and associated tendons. The most commonly injured rotator cuff muscle is which one? Is it supraspinatus, infraspinatus, teres minor and subscapularis? Which one? Yes. So many of you are able to give the right answer. Okay, not C. The most common muscle is not subscapularis or teres minor. Sometimes you can think of infraspinatus also, but the best answer would be supraspinatus. The majority has given the right answer, supraspinatus. Tell me, what is the role of supraspinatus in the rotator cuff? What is the exact role of supraspinatus in the rotator cuff? What is the function of supraspinatus? You have humeral abduction, you have lateral rotation. So, yes, you have humeral abduction and lateral rotation. Tell me, supraspinatus performs what? Excellent. It can actually help in the humeral abduction. Very good. So, overhead abduction is done by which one? Overhead abduction is done by which muscle? Which one helps in the overhead abduction? Anybody? Very good. Initiation of abduction. Srini Jamaradi. Very good. Overhead abduction. Who helps in overhead abduction? Okay, let's look at the leaderboard now. Excellent. Very good. Serratus anterior. Very, very good. Serratus anterior. Okay. So, AV, Tom, Hemalata, Dr. Jack, Sana, O, Venkatesh, Sweet, Dragonite, IMSP, CHMC are on the top 10 areas. So, now deltoid, trapezius. Okay. There are many things coming up. Okay. Question 20 of 26. Answer fast to get more points. Suprascapular artery arises from which of the following branches of subclavian artery? Is it internal thoracic artery? Is it thyrocervical trunk? Is it costocervical trunk? Is it dorsal scapular artery? Which of the following? Yes, very good, Moshfek Khan. You have given the right answer. It was deltoid muscle. Okay. So, suprascapular artery arises from the branch of subclavian artery called as thyrocervical trunk. But it is not internal thoracic artery, costocervical or dorsal scapular. Remember, the internal thoracic, thyrocervical, costocervical and dorsal scapular, all four of them are branches of subclavian. But totally, how many branches of subclavian artery do you see? Subclavian artery contains how many branches? Subclavian artery contains how many branches? Yes, come on. Excellent. So there are 5 branches for the subclavian artery: vertebral artery, internal thoracic artery, thyrocervical trunk, costocervical trunk and dorsal scapular artery. And the thyrocervical trunk is the one that gives a suprascapular artery which can help in the supply of supraspinatus. And remember, when you go for the initial 15 degrees of abduction, you'll be using supraspinatus. After that, deltoid and also your trapezius can be helpful. So let's move forward. Yes, very good, Surya Tejasvi. There are totally 5. AV, Hemalata, Tom, Dr. Jack, Ose, Venkatesh, Sweet, Sana, Dragonite, IMSP, CHMC. Okay, let's look at the next question. This is question 21 of 26. We're coming near the end of this particular quiz contest. Answer fast to get more points. In the lungs, bronchial arteries supply what? Till terminal bronchi, till segmental bronchi, till respiratory bronchioles, till alveolar sacs. Which one is the right answer? Okay, the majority have given the right answers again. The right answer would be till respiratory bronchioles. The bronchial arteries, that is the blood supply to each of the respiratory tract with the respiratory airway, will be supplying. The bronchial artery will be able to supply till the respiratory bronchioles, not till the alveolar sacs. Okay, now let's look at the leaderboard here. So I think still AV holds the top position. AV, Tom, Hemalata, Dr. Jack, O, Sweet, Sana, Venkatesh, Dragonite, IMSP, CHMC. Okay, well played. Let's go for the next question. Question 22 of 26. Answer fast to get more points. Proved etiology of primary brain tumor is which one? Radiation exposure, infection, alcohol, smoking. Among the four, who has a proven etiology? Who among the four has been properly proven to be the etiology behind primary brain tumors? If it is secondary, it can be any reason. It can be all of them. But when it comes to primary brain tumor, what could have been the proven etiology? Happy times, you came so close. Mashre Khan, good. Abdadeep, well tried. Okay, the majority has given the right answer. Please remember, radiation exposure is the most important etiology for primary brain tumors. The more the exposure towards radiation, which is measured in terms of grays, you will rads and grays, you will be able to understand that the primary brain tumor is mostly caused by radiation. And radiation is capable of causing molecular changes in such a way dimerization can happen. And remember, infection is not a very common cause of primary brain tumor. Alcohol and smoking, among alcohol and smoking, smoking has more sequences than that of alcohol. Okay, let's look at the leaderboard here. Yes, very good, Srinidhi Kirtana and Paulamidas. AV, Tom, Hemalata, Dr. Jack, O, Sana, Venkatesh, Dragonite, Sweet, IMSP, CHMC, very well played. Any other answer? We'll go for the next question. Question 23 of 26. Answer fast to get more points. Not a type of pemphigus. Which one is not a type of pemphigus? Is it Pemphigus vulgaris, Pemphigus vegetans, Pemphigus bullosae, Pemphigus erythematosus, Pemphigus foliaceus? Among them, which one is not a type of pemphigus? Excellent, the majority has again given the right answer. The answer would be Pemphigus bullosae. There is not such a thing called as Pemphigus bullosae, but what is the most common type of pemphigus? It is Pemphigus vulgaris, and that is why 0 people have chosen the answer as nobody has chosen Pemphigus vulgaris. Vulgaris speaks about the most common presentation. So Pemphigus vulgaris is the most common, and foliaceous, erythematosus and vegetations have equal kind of weightage. But there is no pemphigus called as bullosae in terms of dermatology question. Okay, let's go one step forward. Let's look at the leaderboard here. So AV, Tom, Hemalata, Dr. Jack, O, Dragonite, Sweet, Sana, Venkatesh, IMSP. Let's go for the next question here. Question 24 of 26, the last 3 questions in a gallery. Okay, answer fast to get more points. Come on, people. Come on, make it up. Spironolactone is contraindicated with which of the following drugs? You should not be given spironolactone when you are giving which kind of drug? Enalapril, atenolol, verapamil, chlorothiazide. Which one? Come on, let's see how many of you can give me the right answer here. And if you could tell me the reason. There are 2 reasons why it should be contraindicated. Can you tell me why? Okay. Naisargi and Avantika are saying A. Dr. Surya is saying D. Anybody else? Come on, people. Okay, everyone has voted. Enalapril is the right answer. It is the majority. Now think about it. Spironolactone is an aldosterone antagonist and enalapril is an ACE inhibitor. When aldosterone is actually going in the right pathway and AC is also happening in the right pathway, ultimately when aldosterone is present, it can cause reabsorption of sodium and excretion of potassium. When you inhibit them, then you will be having reabsorption of potassium or prevention of loss of potassium. So when you give both spironolactone and enalapril, both of them are capable of causing hyperkalemia. Well, chlorothiazide is actually a thiazide diuretic. Atenolol does not actually make a huge difference in giving a spironolactone as a antidiuretic. Okay, yes, the hyperkalemia can cause fatal arrhythmias. Okay, so AV is still on top, followed by Tom, Hemalata. AV is followed by Dr. Jack, Tom, Hemalata, O, Dragonite, Venkatesh, Sweet, Sana, IMSP. Okay, let's look at the next question. 25 of 26, the last two questions. Come on, people. See whether you can make a difference and enter the top 10. Drug of choice for treating precocious puberty in girls is which one? Danazol, cyproterone acetate, medroxyprogesterone acetate, GnRH analog. Which one? Which one is the drug of choice for treating precocious puberty in girls? Moshfek Khan, Anabhadeep, Surya Tejasvi, Avantika have given D as the answer. Anybody else? Happy Times is also saying D as the answer. Anybody else? Okay, excellent. So the majority wins again. See, danazol, cyproterone acetate, medroxyprogesterone acetate can also be given in case of precocious puberty, but not mainly in case of girls. Why? Because when you speak about girls and precocious puberty, the most common type of precocious puberty would be central precocious puberty, for which GnRH analogs can be given. But if it is a boy, in case of other than girls, in case of boys, it is peripheral precocious puberty where danazol, cyproterone acetate and medroxyprogesterone acetate can be useful. So I repeat once again, in this question, the key word is girls. That is the reason for central precocious puberty where you can hit using GnRH analogs. Let's look at the leaderboard here. AV, Dr. Jack, Tom, Hemalata, O have given the right answers. Venkatesh, Dragonite, Sweet, Sana, IMSP. So this is the last question for the day. Let's see who emerges on the top and who are the people who are present on the top 10. Answer fast to get more points. 17-year-old male on examination, small nodule in a normal size prostate, PSA value 17 nanogram per deciliter, normal urine analysis is seen. Which histopathological finding is best suited? Acute prostatitis, adenocarcinoma, chronic bacterial prostatitis, nodular hyperplasia, prostatic intraepithelial neoplasia. Which one? Okay, Srindi says D. Anybody else? Moshfek says acute prostatitis. Okay, so the majority is not correct this time. You have to focus on adenocarcinoma. Look at the PSA values. PSA values are very, very high. It is 17 nanograms per deciliter. And the age. Now, the most important key word here is the urinalysis is normal. If at all it is bacterial prostatitis, the urinalysis would have not been possible. And look at the age. Even though it is a small nodule, the prostate size is normal. The prostate size is not very abnormal. Normal prostate size, when you have a small nodule, it cannot be a nodular hyperplasia. If it's a nodular hyperplasia, the size of the prostate would have been enlarged. And also it is not intraepithelial neoplasia because the PSA values will not be elevated in case of intraepithelial neoplasia. So two important points. One is the age, 71 years. The second one is the PSA value is very high and it is a normal size prostate. That is why we go for adenocarcinoma of the prostate. I hope this was helpful for you. I hope you'll be able to use this information. Before I show you the leaderboard last minute, are you all happy with the quiz? Will you be coming back again? The next quiz will be on 14th and then on 16th. This is just to motivate you in a fun way to go for your NEET exams. How many of you are NEET aspirants here? How many of you are NEET aspirants who are going for the NEET exam here? I'll be doing a rapid revision session of microbiology and biochemistry sooner. So in case you'd like to come, please visit. So the next quiz is on 14th and 16th. Thank you very much. So let's look at the leaderboard here. And before we wind up and telling the right answer, when you log off this video, when you go offline from the live session, please put a thumbs up. Please click like on this particular video so that other people will be able to see the questions, see the video faster. Okay, so this is the ultimate leaderboard. IMSP alone gave the right answer for this question, so he makes a difference. He comes into the top 7th position. AV, Dr. Jack, Tom, Hemalata, O, Venkatesh, IMSP, Dragonite, Sweet and Sana have gotten the top 10 positions. Very well played. I'll do the rapid revision sooner in the month of March before you go for exams. And NEET PG exam has been postponed by 6 to 8 weeks, so we'll do it in the month of March or in the month of February at the last week. And congratulations AV for becoming the top, other toppers, very good. All others who have made a very good job, thank you very much for coming to play this game. Have a great day. Okay, I'll see you soon on 14th, again same time, 7 p.m. Next, I'll bring you more questions to fight for, and when I give you more questions, let's play it even more vigorously and ferociously. Thank you very much. All the very best. Study very well, people. Good night.